The outgoing CEO at the Center for Family Health, Molly Kaser, and the interim CEO, Sarah Benedetto. Welcome to the show.
Thank
Hi,
you.
thank you.
Good to see you, Bart.
Good to see you, Molly. Congratulations on your retirement.
Thank you.
How many more days do you have left?
7.
Who's
She's not counting, right?
Oh, just 7 days. Awesome. And how many years does this wrap up?
Oh gosh. So this coming June would be 32 years.
Wow.
Yeah.
The one and only CEO of the Center for Family Health.
Time for a change.
Yeah. Yeah. Now,
Out with the
Sarah,
old, in with the new.
you haven't been there 32 years.
Not quite.
Not quite, but
much
almost.
Close. I started in '91 as a volunteer, and then I think
Yeah.
became employed in '92,
That sounds about
about
right.
right around
Yep.
there. So
And you've
Yeah.
been the COO.
for a number of years.
Many years.
Many years.
Yeah.
10, 12, I think.
Oh, at
More than
least.
that, probably.
At least, yeah.
Yeah.
Hmm.
So she has seen it all and done it all also.
And she'll be
Yes.
filling in with it all for perhaps a few months. I know the board is conducting a search, and that's happening. I believe there's a firm that's been hired.
That's correct.
Yeah.
A search firm has been engaged and the process is moving along. So I anticipate this summer, at some point, a decision will be made.
Well, I know I've been working at it a long time, but those are big shoes to fill.
Well, thank you.
You stole my line.
It
Yeah.
will all work out. I envision a very orderly transition and a wonderful person being chosen to continue what we've started and probably expand.
Expand.
Well, expand as in there are probably other ways to do things and other projects that maybe I haven't thought of or others, so it's pretty exciting.
Well, you look back at these 32 years, it's pretty amazing, what the center and its leadership has accomplished, because it was from nothing. There was no
Yeah.
center.
No,
32 years ago, there was no Center for Family Health.
correct. That's correct.
How did it come about?
Oh my gosh. So, as we all remember, pregnant women in Jackson who had Medicaid, uninsured, couldn't get prenatal care locally. The health department was coordinating getting them out of town for prenatal care. And we had hundreds of women a year in that situation, and then many would just walk into the ER in labor. And we ended up with a very high infant mortality, infant death rate. And the community said, what the heck is going on here? Because most people weren't aware that care was not available locally.
Well, I think maybe you experienced this, but when our kids were born, it was hard to find OBGYNs in Jackson. We just didn't have enough to begin with
Yeah,
for a while.
yeah. Yep, there were a lot of circumstances. And then the unfortunate thing is that when those babies were born outside of Jackson at that time, the pediatricians in town said, hey, if the baby was born out of town, we're not going to take care of them. So it was a bit of a double whammy. So yeah, to open the prenatal clinic and make care available locally and to treat everyone with great respect and dignity.
Well, let's go
People
back.
liked it.
We have some pictures.
Oh, gosh.
First, the ribbon cutting, which before it was Center for Family
Oh
Health.
my goodness.
It was known as the Center for Healthy Beginnings.
Healthy Beginnings, February of '91.
Yeah, so
Yes.
this is
So this is the parade of haircuts through the years.
this
I have a
is
feeling.
the current building.
Correct. This
and-
is our downtown building. That was our ribbon cutting. You can see Senator Stabenow there and board member. The U.S. Department of Agriculture was there. You see Karen Dunnigan standing there in the yellow. John from Christman.
Frank Weathers
Yes.
in the background.
Yep. There was the construction. And now this was the dental building. I can tell because I can see the fire department
Yeah.
next to it. Yeah, so that would have been in about 2015.
The old Art Main
Showroom.
showroom.
Yes. Yeah, there was a lot of contaminated dirt to haul away from the years. Yeah.
That's pretty current because we can see our testing tent
Total
there.
COVID tents.
Yeah.
COVID tent off to the side.
Yeah, the things we're doing, yeah. It's been pretty exciting. So that was the ribbon cutting in 2011.
It's amazing how that stretch of North Jackson Street has changed with
Yes.
both centers and the United
the-
Way.
And the
it's-
ambulance company
Yeah.
has really stepped up. And that's part of what health centers do, is we are always trying to provide some economic development.
1991,
was-
so this is the ribbon cutting.
Actually, I think that picture was
That doesn't
from,
go with, no.
correct, that was from Northeast Health Center.
Yeah, because that's
our
Doug.
first school health center. Doug, who was with, yeah.
Yeah, Aeroquip. He's Aeroquip
You're
retiree.
good, yes.
Yeah.
And Marty was mayor at the time, Marty Griffin. So yeah, that was over at Northeast, our very first school site.
Yeah, so there's no film from 1991. All the negatives have been lost because it was so long ago.
Probably.
Probably.
Were there even cameras
Either
back
that
then?
or we were just hiding them from you.
Yeah.
There's just artist renderings.
I do remember that ribbon cutting or that reception we had over on High Street in early 1991. Yeah, it was a pretty small space, but it was very well attended, and we had people just saying, "How can I help? How can I help? This is so wonderful, so needed." Everyone was trying to find a way.
Yeah, it was just a little corner of the old, at the time, Michigan Bell building, which is, I think,
Community Action Agency bought it from Michigan Bell and owned it until, see, I have all this history, 1995 when the hospital bought it, and then the hospital sold it to Sealand Air.
Yep.
It looks great now.
did.
Oh my gosh, such an improvement.
So, Sarah, all these years you've worked with Molly, I know you're going to miss her, but what are the things
Sure.
that you credit Molly with, and things that you're going to miss?
Oh my gosh, I credit her with all of it, actually. I mean, because she's really just done amazing work and provided excellent leadership. So, like I said earlier, she has tough shoes to fill. So many things, I wouldn't know where to begin. Of course, she showed our new buildings, and those things are so important because we've been able to provide more access. But her innovation and her vision that she's helped to articulate to the board and to the staff is really, I'm going to miss that. We miss lots of things, and we don't want to get emotional here. So.
I think the buildings, that's one of the things which I remember at the time, people thought you were maybe a little off your
Crazy.
rockers. Yeah.
Crazy. Yes.
Because it was so ambitious. When you look at the size of that, your main building, did you ever doubt at any point that it wasn't going to happen?
No.
No?
No, I really didn't. And I have to admit that I had a hard time understanding why people didn't see it, why they were risk averse. It's like, of course we can do this. I just felt that we could, and there were some federal funds available for health centers at that time, and we received, I think, about $1 million. I think it was in 2009. It was through stimulus funding. And a couple of board members said, this is our opportunity, because we'd been talking about a building, and we said, this is it, we're going to do it. And then the Affordable Care Act came along, and there was more funds for health centers to do capital. So, but no, I don't think I did doubt, or if I did, I have sublimated it. It's gone.
I don't think you did. If you
I don't
did, you
think I
kept it to
did.
yourself because we really
Yeah.
never knew that you doubted it. So it was,
Yeah,
yeah.
that was
It's gonna
that was pretty
happen.
exciting.
Well, not only managing a health system, but you were doing fundraising, you were doing recruiting, you're doing all
Yeah.
the things really, which I don't think were part of your job description to begin with.
Well, it was a pretty inclusive job description, but yeah. Yeah, that's true. All of those things continued during all the capital campaigns and the building. And actually the building, the medical building downtown, Sarah took that project on and it absorbed her life for an entire year. And she still kept all the other ships running or trains running, but she did
She had a secret weapon. Her husband's a
job.
contractor, and I think she leaned on him.
I did, but I really had fun with throwing around some terms and impressing him with things that I would come out and say, things that I was learning.
The secret language.
Yes.
Yes.
So what about your look back on 32 years? What are you going to miss?
Oh my God, so many things. So many of the staff were just delightful, and so much passion for what we're doing. And it's so fun to see people who join the center. Maybe they're not really sure what this whole thing's about, but the job looks sort of appealing, and then they get bitten by the mission and become very passionate. And that is so fun to see.
What are you most proud of?
What I am most proud of, I'm going to cry here, Bart, this isn't fair, is that people know they can get care from us. And that wasn't always the case.
It's probably impossible to measure, but there's probably been a lot of lives saved because we have this.
It's true.
Yep.
And people have actually said that. They said, if it weren't for the care I got here, I would not be alive today. It's pretty powerful when you hear someone say that. And I think we're up to probably by now about 12,000 babies that have been born. So,
And while we still have a ways to go, our health outcomes for pregnant women and newborns still not as good as we'd like, but it's improved.
It's improving. Yeah, it is improving. And we're making, despite COVID, Sarah and I were just talking, despite all the COVID stuff, we've made some good improvement for our patients with diabetes and high blood pressure. So yes, there's always more work to do, but we have very good systems in place and a lot of very caring staff. And I foresee continued growth, and there'll be a lot of fun things coming. I have no doubt.
Yeah, and hopefully an opportunity for the community to say thanks and good luck, but unfortunately we can't do that just yet.
Yeah. Yep. Well, I'm getting lots of nice messages, and it's always nice to hear from people.
So what are you going to do now after these 7 days are up?
Not a darn thing. It's going to be an adjustment not having a schedule. That's the thing I think about the most, is my time will be my own, and my poor husband, I'm probably going to try and schedule him in all sorts of ways and organize him, which he won't really care for, but
He's been retired, and he's been able to be retired just fine without you.
yeah, how does that work? So we'll be making some improvements there.
And your kids?
Kids are one in New York City and one in Seattle, so we'll be traveling to visit.
There you go.
Yeah.
That's what you'll be doing.
Yeah.
Grandkids?
And that,
No.
not yet. I keep saying not yet, yeah. So yeah, just traveling to see them will be, and the fact that I'll be able to do that when I want, when it works, so yeah.
Awesome.
I'll stay busy. I'll stay busy not doing much, and that's okay too.
Well, congratulations.
Thank you, Bart, and thank you for all the years. I remember when you started JTV, and let's talk about taking a big risk. You did it. It has worked, and JTV is so much a part of the community, and I certainly appreciate all the support you've given our health center through the years in many ways.
Well, thank you
So
very much.
thank you.
For sure.
It's been great working with you, and
You too.
Sarah, we'll look forward to continuing working with
Yes.
you
Thank
and
you. Same here.
the center.
Yeah.
Great to see you both.
Thank you.
Thank
Uh,
you.
Soon to be the retiring soon to retire, 7
There we
days, 7 days. CEO, founding CEO, Molly Kaser, and interim CEO, Sarah Benedetto. Stay tuned, we've got some more celebrating to do, some birthdays and anniversaries.